As always, we try to start right at 6:30. I value everybody's time here, and I try to keep everything within half an hour. There's a half an hour of a lot of information that comes forth from my mouth in this half an hour, so I don't remember everybody to remember it all, but I do ask that you take one nugget of information that will help you to improve upon your health, share it with someone. If there's information here that you feel is important enough for you to share, then invite somebody to a workshop. Thank you for coming. And your name again was?
Betty.
Betty. Thank you for being here, Betty. It's in sharing that we inspire other people to actually take hold and work on getting the community healthier and work on getting ourselves healthier, because if we're sharing, we're then truly understanding. And you know, there's a couple of different ways that many different cultures approach it, but some people say, you know, if the teacher is a parent, the teacher is a parent, the student will show, or vice versa. If the student is there, the teacher will show up. Ultimately, you have to be willing. You have to be willing to learn, and open enough to learn. And my hope is that you are, because in what we do here in this office, I was talking to someone about this actually earlier, is that honestly, a lot of people come in, why? To feel better, or they're broken, or they want something fixed, or they feel that they can fix it. But honestly, if you think about it, does it staying healthy ever really end? Okay, and just because you don't have pain, eventually it ends, yeah, right, but then you have no problems, right? You have nothing going on, right? You know, everybody dies sometime, you know, but ultimately when we look at, you know, we need to take care of ourselves for the rest of our lives. And if you have pain, yeah, that can be a warning signal to something, that something else is going on, but you could be walking around with no pain and have a problem going on also. And that has happened too, and I'm sure there are many stories that you may be able to come up with or know of people that have gone to the doctor and all of a sudden something is going on in their body. So ultimately, our hope is with these workshops that you have an understanding that no matter the situation you are in, no matter what's going on, that you have the ability to adapt to that situation and allow your body to heal. We're going to be talking about headaches, but what's a big thing that's going on right now in this time of the season? Allergy. Everybody, it's all at once, you said it, allergies, right? It's amazing because this season, everything is hitting all at once. So a lot of people are getting very congested, and the headaches come on with that too. And we did a whole allergy and asthma class a couple of weeks ago. But ultimately, even with that situation, your body needs to learn how to handle it on its own, because if you're pumping the medications in, it never learns how to fight it off and learn how to adapt to it. So it's miserable. I was talking to someone, it feels miserable, but if you give it time, the body learns how to handle it. Okay, and those are the things that we want to talk about, because what do people usually do? What do people usually do when something like a headache or an asthma or an allergy or even any ache or pain shows up? What do most people do?
Take a med.
Take a med, right? They take a med. They take something to get rid of the discomfort, right? There's a time and place for that stuff. Don't get me wrong. I'm not bashing anything. I'm just trying to explain to people that sometimes you have to let your body run its course so we can learn what to do the next time, because otherwise it won't. And you know, there are a lot of side effects, and if you want to learn about that stuff, next week we're doing what doctors know but don't talk about, and a lot of that refers to certain medications here and there. The class changes. It's very dynamic in the way it changes, because I'm looking at studies. Next month, you'll see on the schedule of workshops that the second week is usually some sort of family type of situation. It could be epigenetics, it could be backpack safety, it could be just asthma and allergies, because a lot of people think about those things. Third week is usually some sort of nutritional subject. Next month we're doing sports nutrition. You know, this month we did eating greens, why it's important to eat greens. And then the last month is usually some sort of specialty, whether it be carpal tunnel, low back. You know, the symptoms that a lot of people come in for, and why things are going on. Hence, headaches. This is the fourth week. We'll have our drawing this evening for the pillow. Every time you come to a workshop, you get your name in a basket, and then at that last workshop of the month, someone picks out a name, and that person wins either a pillow, a gift certificate, something, you know, something going on. So we just want to reward you guys for doing the things that is right. So, bearing the burden. Why are headaches such a burden on most people? Who gets them? Everybody, right? Everybody gets them, okay? 90 to 95% of the people will get a headache at some point in their life and time. Have you ever heard of somebody that's never gotten a headache? I've heard of like one or two. I've heard of one or two, but at some point or time, you get something going on. Women, men, youths, older people. There are different types of headaches too. Some are from medications, some are from stress, some are cluster headaches. And you know, and at the end of the night, if you're interested in some more information, I have the brochures here about migraines and cluster headaches and headaches. But the ultimate thing is, everybody gets headaches at some point in time. Okay, but we have to understand where they're coming from. So bearing the burden of has individual. For an individual, there's a frequency and duration of attacks and impact on the quality of life. How does it affect your quality of life? It depends. So, well, give me an example.
Well, migraine can be debilitating. You can't do anything. Where maybe like a little headache in the back of your head. It's not really affecting you too much, but it's there.
It's there.
You can still function.
But you can still function.
It's annoying.
It's annoying, right? But does it not make it, when you're annoyed with the headache, that if someone is speaking to you, doesn't it make you a little more short with that individual? Or you might snap at somebody, you know, because the thing is, you know, these are the things, it doesn't just affect you, it affects those around you. Okay, so that's a pretty heavy burden, because what's happening is you are suffering, and you may want that person to understand that and leave you alone, okay? Or they just might, you know, just the sound of their voice might bother you. I don't know, that happens. But it's very important to understand, because it can change the quality of your life in totality. So that's what comes on here. Reduced family, social, and recreational activities. Why are these so important?
That's your quality of life.
That's quality of life. Shari, what did you say?
It makes you well-rounded.
It makes you well-rounded. I mean, it really does. They find now that, you know, especially in the older population, people that are like involved. Like I go to Heritage Heights in Havenwood, and there's a lot of social things that they do together. Okay, they do things together, and it really makes a difference for these people, because it gives them something to look forward to do, okay? Because rather than sitting home alone and, you know, and not having any family or anybody around. So that's huge, but if you're affecting that due to headaches, then obviously it's gonna cause a problem. Societal, direct medical care costs, that's a huge factor. We're gonna talk about that. Indirect costs of lost work and productivity. So this is the stuff that can't be measured. It's the intangible stuff that can't be measured. You know, sometimes when we work, employees, what is one of the most important things to workers to be recognized by their superiors, managers, superiors, people? Good work, right?
Be there all the time.
Yeah, being there all the time. They want to be, you know, they want to be recognized. They want to be. It's more so than financial. Okay, although, you know, people will argue that fact, but, you know, it helps in making it easier. But ultimately, if you're miserable from headaches and you're sitting there at the computer and you're working, you're indirectly going to bring on your own issues, you know, your own issues in itself. And there's going to be non-tangible things that they can't measure, but eventually it becomes tangible. So those are things that we have to look at. So everyone can be affected by someone's headaches. I will give you an example and speak a little bit about my own issues. When I was, by the time I was 25 years of age, I had 2 spinal taps. I was on 6 medications and had, at the age of 22, lost 3 months of college. I was a mechanical engineering major, and I lost 3 months of college because I slept 2 hours a night because of my migraines. Okay, they were so debilitating that I couldn't sleep. I would literally fall asleep in a chair. If I laid flat down, the pain would get so extremely painful that I would literally throw up. They finally diagnosed me with something called pseudotumor cerebri, and that's increased spinal fluid pressure in my spine. And the only thing that helped was spinal taps. They would puncture my spine and, puncture the sac, get the fluid out. Boy, you want to talk about miserable, okay? What a way to live your life, okay? And then you add on top of that all the asthma and allergy stuff I had. So, at 25, I was not the healthiest person, but I thought I was healthy. I was working out, I was doing stuff, but I was taking 10 medications. Made no sense to me. At one point, I had to sit down and say to myself, something's wrong with this. But I didn't realize how it was affecting all the people around me, okay? Because one, the burden of the cost of all those medications was insane because I was just working to pay for my medications basically. And then at that point I was dating Julie, my now beautiful bride of 25 years. And the thing is that it affected what we were able to do. I mean, we couldn't go out and enjoy it. We used to bowl. We were bowling. I couldn't go out. I had to lay in bed literally and couldn't move. Okay. So, this is very personal to me because it really affects people's life and they don't understand how it's starting to affect those others around them. And if there are people around you that are trying to help, let them. Don't just push them away, let them help. Okay? Because the important thing to understand is that there's a reason why they're there. Okay, and the headaches, you might not want to help, but don't be so stubborn that you don't take the help, because it's important to understand, because if they can help you relieve some of the stress that's going on, guess what? Some of those headaches are going to go away. And I thought it was just because I was stressed, I was in school, I had a lot of tests. It wasn't the case. I had, and chiropractic changed the way I looked at it, and it also changed my life. So. But that's another story for another time. So, but I personally have experienced this. So this is really important to understand that it's not coming from just, speak. So this is a question. As I bring these up, okay, did you have a headache that caused you to miss work or school? Someone raise their hand. Okay, so about half of you, okay. Reduce your productivity at work or school by half or more. There you go. Mine was definitely because of what's going on. Not do household work.
That's just an excuse.
Yeah. What's that?
That's just an excuse, really.
But that's an excuse. Yeah, I don't want to do the household work. Right. But but the thing is, I mean, it's I get people do that. I mean, I get it. Reduce your productivity in household work by half or more because of your headaches. Yeah. I mean, think now with all the yard work. It's like, I got a headache. I don't want to go out there. I get it, miss family, social, or leisure activities because of your headaches. Has this happened to you? Never? Yeah. This is the rounding of your family. What is your quality of life is the question. You have to ask yourself this question. How far is it affecting what you're doing? So lifetime prevalence of primary headaches, 78% of primary headaches are tension headaches. So the presentation usually of tension headaches is the presentation is usually what they call hat band. So when I was in school, if you were presented with a hat band representation of a headache, that was usually associated with a tension headache. What is a tension headache? Stress. Okay, but stress can be physical. It can be emotional. It can be chemical. Okay, so it could be trauma, some sort of toxin. Okay, it can be almost any one of those. So you really have to be aware of what you're doing and how you're taking care of your life and the things you're doing. We're going to talk a little bit about dietary and things of that nature afterwards. But But this is important because 78% of them are headaches or tension, okay? 40% of the US population can be affected at any given time. Migraine headaches, 16% of primary headaches are migraine. 1 in 4 households have one migraine sufferer. That's a lot. That's 25% of the households having a migraine sufferer. That's a lot. I mean, wow. And you know, I hear people say to me, oh, I have a migraine. And I look at them and I say, do you have any idea what a migraine really truly is? Migraines usually show up one-sided. They are sometimes both sides. They're usually one-sided, and it feels like. And there's different types of migraines. There's the classical. There's the oral. There's the optical. You know, there's different types. But the classical one usually shows up one-sided. Okay, and it feels like someone has literally taken an ice pick and stuck it in your eye. Okay, and it goes right through into the head, and it makes you dizzy. It makes you nauseous. It makes you, I mean, you get photosensitive. Photosensitive meaning you can't have bright lights. I mean, it's horrible. It's absolutely horrible, you know. And so it's those are usually what's going on. With some migraines, you have something that will trigger them. They can be chemically triggered. It's like some people with wine or chocolates or some things like that, or even inflammatory meats. Some of those things can trigger them. But some people have what they call prodromal effects. Prodromal effects are things that you sense before you have a migraine. So some people, all of a sudden, they might have a hypersensitivity of smell, a certain thing, like someone might smell almonds. And I'm just saying, I'm throwing this out there. And then all of a sudden they start getting a headache. Okay, or they might sense something, or they might sense something else, like orally, you know, that something's going on, and they might have a ringing in their ears. And that's a trigger of that. So the thing is, a migraine, when you truly have a migraine, it's much more than just, oh, I have a really bad headache. It's debilitating. It's literally, you don't want to move. Like I said earlier, for 3 months when I was in college, and well, I was about 2/3 of the way through my mechanical engineering degree, and the headaches hit. So from the age of about 20 and a half to 22, I struggled just trying to get through my junior year. And so you're talking a year and a half of trying to figure out what's going on. Thank God Julie was around and she saw what was going on. And I would literally, I mean, I could not even walk out the door. I would have to sit in a dark room. And it was almost like I was depressed. Okay, and could that make you depressed? Mm-hmm. Yeah, I mean, you become part of your pain. So you really need to get up and do something and move around, but it's one of the hardest things to do when you're in that much pain. Okay, and Julie would come over and she would see, and I would literally, I mean, I have remnants of the circles under my eyes. I mean, if you looked at the circles under my eyes, they were black like this when I had that going on. I really try to get people to understand, if you have a migraine, you'll truly understand what the true pain of a migraine is. Okay, because it debilitates you. It doesn't, if you have a headache and it's really bad and you start feeling nauseous, then you might be going into one of those. But understand that there's something going on, but you look at the difference. 78% of the primary headaches are tension headaches. Okay? A lot of the headaches that come around this time of the season are histamine type headaches. They call them cluster headaches. They come on, you have no idea where they come from, and then they go away. Okay, but they can be caused by, you know, allergenic type responses. They have no idea. But it feels like someone is like taking the whole left side of your head or the right side of your head and just, you know, stuck like something in there. And it feels like you've been hit with an axe. I mean, it's horrible. It's absolutely horrible. So this reference comes from the Epidemiology of Headaches Cephalgia Journal. Everything I have in here is referenced. So if you guys want copies of the articles and things, I can pull out the references, and then you can go get the references. Read that. That's scary. Combined. And how prevalent is this? Very. How prevalent is this now? Very. More common than both combined. That's scary. That's really scary. The costs. Lost work due to migraines on average 6 days a year, okay? Pain and disability increases over time, which is what happened to me until I finally went to a chiropractor. Direct medical costs are about $1 billion a year. That's just for migraines. That's scary, okay? You know, I always use the example of you know, trying to give people an idea of how much time is wasted and used on things by television. And I used this example, I think, last week too. If you watch an hour, who watches an hour of TV a day? Yeah, I do too. On average, I probably watch an hour of TV a day. Okay, if you think about watching an hour of TV a day, okay, and you figure out how many work days there are in the typical work year, it's 240 days, okay? It's not 365 because you have the weekends off, okay? That's 240 hours of TV a day, a year. That's 30 business days of TV that you've watched that you could have been doing something else. That's a lot, that's a lot. And people are like, oh, I just need to relax. Well, yeah, but if you don't have time to do something and you're stressing out because you don't have time to do something, get away from the computer, get away from the phone, get up off your butt and do something, okay? And it literally will change the way you look at this stuff too. Because what happens is when you become active, this stuff starts to take care of stuff on its own, and then you have to add other things, obviously. But this is a lot of money. That's $1 billion a year. Cost to U.S. employers $13 billion a year in missed work and loss of productivity. That's scary. That's a lot of money. I sit there and it's just a drop in the bucket compared to what we spend on healthcare costs in this country. Okay, but it's still a lot, okay? What now? Taking more than 3 aspirin or other meds 2 to 3 times per week can turn intermittent headaches into chronic and daily headaches. Why?
Because your body's used to the level of medication.
Yes, very good. Thank you for translating for me. Okay, you know, but that's absolutely true because your body gets accustomed, and it was like what I was talking about when I first started the workshop. If you're taking stuff to try to get rid of the aches and pains, your body never learns how to handle it on its own. Okay, because it doesn't have to produce the chemicals there's 60,000 different chemicals that are in our body to help fight this stuff off and learn how to fight it off. You have a headache, don't you? Sorry, it's the lights too. It's the light. Fluorescent lights are one of the worst things that you can be under when you have headaches because they flicker. There's a vibration. This isn't bad, it's just bright. This is an LED, so you can't even see the thing. Like this one you can, but this one is an LED. The LED lights are just very bright, but they don't have the vibration, the
You
flicker.
should have a switch one switch for smaller lights and then.
Yeah, I wish. At least 75% of those with the highest grade of migraines were not adequately treated with medications. I was taking 6 medications. They gave me diuretics because I had pseudotumor cerebri. They gave me barbiturates to kill the pain. And then the doctor, I can remember the doctor said, oh, if you start getting a headache, take one of these Fiorinol, and then if it doesn't go away, take 2 more and half an hour later. I was like, okay, you want me to be a basket case? I mean, you walk around like, oh yeah, I feel great. You know, I mean, but the thing is, you know, it's really, they can't treat it with the medication. It just doesn't take care of it, okay? Because you got to look at what's going on. This is by Dr. Richard Lipton. Dysfunction in neck muscles contributes to the headache pain and is the reason chiropractic deals so well with tension headaches. Reference Schwartz, Epidemiology of Tension Type Headache, Journal of the American Medical Association, 1998. This was, 98 was 17 years ago, okay?
Why don't the medical doctor, why don't primary doctors understand that kind?
Because they don't look at their own studies. And but the thing is, they refer to other providers that they think can do the same thing that we are doing. And what happens is they don't have the hours and hours of training that we do. I mean, you look at how busy we are in this office. You know, do you want somebody who's done maybe 100 manipulations, quote unquote, is the way the medical society manipulations, over a year, or do you want someone who's done thousands of them?
Again,
Okay,
if you
because,
need-
you know, but the thing is, what we do is we adjust, and that's in a whole other workshop where we talk about the difference between adjust and manipulation, and they lump that stuff in together, but this is their own studies. Okay, but for some reason, they don't refer to it and even try to do that. So I sit there, I'm like, you guys are saying it for us, I don't have to say anything. But yet, you still fight with it, and some doctors are very good with it. Okay, they will look the other way, you know, to further it. But this is the Mayo Clinic. Everybody knows what the Mayo Clinic is, yes? Okay. Decrease their treatment for goals of headaches: decrease severity of pain, shorten headache period, prevent attacks. Okay, that's pretty good. The goal in reducing headaches is to relieve pressure on the nerve roots in the upper neck. This would reduce the activation of the spinal tract of the trigeminal nerve, which is part of the pain center in the head and neck. Reference: Australian Family Physician, Migraine and Its Management by Dr. Michael Anthony. What does that sound like to you guys?
Candidate for chiropractic.
Yeah, it's adjustments. I mean, what are we working with? We're working with the nerve roots. This is trigeminal nerve is cranial nerve 5. It comes right out from the brainstem, right up in the air. Okay. They don't even. It's just their own stuff says it. Okay, I mean it works. You know. Chiropractic adjustments are more effective than medication in treating headaches. Reference: International Conference of Spinal Manipulation. This is not even a chiropractic seminar. This is not even a chiropractic conference. It's an overall conference. The cover-up: stop focusing on the symptoms, look for the causes. Most migraines should be diagnosed as cervicogenic headaches, meaning they're coming from the neck or the cervical region. Okay. The symptoms of the cervical headaches and migraines may be almost identical. This is where it's very, very difficult to determine what the difference is between the two. The importance of the cervical headaches is not recognized. Cephalgia Journal. There has been a 60% increase in migraines over the past 10 years. American Medical Association. Health of Americans is rapidly declining. It is believed over 80% of all migraines are diet-related.
That could,
This is huge. Well, what do we call the American diet? Sad. Standard American diet is horrible. That's what it stands for, SAD, Standard American Diet. Okay, it's horrible. The stuff that we eat is processed and is not the way we were meant to eat. Okay, you need to look at, if you really look at indigenous societies and the way we were meant to eat, we were not meant to eat a lot of the foods that we're looking at now. That's why we do the whole nutritional series of classes, because we do one on reduction of inflammation through proper diet. What's an herbal that you can take to help reduce some of the inflammation, sometimes from headaches? You can try feverfew, you can try devil's claw, you can try those things. We have stuff, the myocalm sometimes will relax the muscles. But you know, the Caprex helps to reduce inflammation. It sometimes helps, and those are things that we sell here. But you can try these herbals. You just have to be careful. You have to be careful of the herbals because you have to know how to take them. Because you know what, taking something or supplement or an herb for a symptom or something else is practicing medicine. Because you're looking from the outside in to cure what the body can cure itself. So if you're taking something to cure it, it's basically just taking another form of medication. Okay, you need to know what goes on with this stuff. I'm not saying it's bad. I'm just saying that some of this stuff works really well. There's another one, fenugreek is also another good anti-inflammatory. Okay, so those are some of the herbals that you can use to try to help. And trust me, I've tried them all because of the migraines I had, because I was tired of taking medications. You know, at 25, I took all 10 medications, threw them out, and my family freaked out, you know, because I was an asthmatic. They were like, oh my God. And I was like, no, it's not going to happen. Nothing's going to happen. But I had a lot of faith in my body and everything, you know, but it took me a long time to gain that faith. Our diets are high in animal fats that cause an imbalance of the body's inflammatory regulatory system. That's why the workshop that we do deals with inflammation of the joints. And inflammatory responses are responsible for a lot of stuff. More so, heart conditions, joint pain, headaches, I mean, you name it, it's a myriad of issues that can go on. Missing link, the next, and you know, many patients labeled with a diagnosis of tension headache may have a headache originating from abnormalities of the cervical spine at a specific level. That's why when we look at your cervical spine, we want to make sure it has the proper, normal, relaxed curve. This comes from cervical headache diagnosis with the aid of computerized analysis of cervical mobility printed in Cephalgia, another journal from the Medical Society. Chiropractic adjustments restore nerve flow, improve posture, reduce muscle tension, improve movement. All of this helps to relieve the discomforts and restore health to your body. Diet. Eliminate food triggers. This sometimes is hard for people because they got to figure out what it is the trigger. Okay, it could be combinations of foods. It could be a processed food that has something in it and then you add something else. I mean, it takes years. I mean, it's not something that happens overnight. But you have to start with making sure that you cleanse everything out that you're taking. Okay, and then from there start adding good foods. And I always tell people, if you're going to change your diet, stop trying to remove all the bad foods. Put something good into your diet. You know what ends up happening? You add greens to your diet, and what ends up happening, it's very filling. You eat fiber first, and you're not going to want to eat a lot of this other stuff because it changes the way your taste buds are. Okay, and what happens is when you eat some of the, like the sweets and the carbohydrates and the things that are made, you know, that are processed, you eat some, and guess what? What happens after you eat it? You're hungry, you crave more. You know, I always joke about Chinese food, you know, it's the MSG. The MSG makes you want to crave more. That's what it is, that's why you're so hungry. So you have to really look at that. Reduce stress, exercise, good sleep, reduce analgesic use. Because what happens is when you're using medications, it just, you know, again, what happens is it doesn't allow your body to normalize and use the chemicals that's there. Fact, 98% success rate in immediately terminating migraines with adjustments and traction. Fact, adjustments provided to cervicogenic headache sufferers result in decreased analgesics by 36%, headache hours by 69%, headache intensity by 36%. What is the one reason people don't want to dedicate their time to doing something like this? Because it's easy to pop a pill. It's easy to go get the store brand name of pill for like $5 in the mega jar and just pop pills. And people think it's healthy. It's not. You're destroying yourself, and what's ending up happening when you're adding all the other stuff. And what's going on is you have to be careful because your body starts to rely on this stuff. And then you got to take more and more and more. So, act before it's too late. And I actually put this up there this time. Nourishment is an important part of our vital needs. We need to eat proper foods. How long can you last without food?
3 weeks.
3 weeks, 4 weeks, 5 weeks. Me, I'm a little heavier and I have a lot of muscle tissue, probably about 6 or 7 weeks. Okay. But let's say 4 weeks, just on average. Water. How long can you last without clean water?
3 days.
A week, maybe. And the thing is, your body will try to, if you drink other fluids or eat other foods, it will try to get, so I'm talking about total removal of water from your diet. But you have to nourish yourself with water, clean water, okay? Oxygen. That few minutes. I mean, I know the world record is somewhere about 22 minutes that someone held their breath. I was like, really? Wow. Yeah, some military guy told me one time. He was here and he told me. And then nerve flow. You are clinically declared dead, Shari, after decapitation. Right? Okay. And subluxation is just a lesser form of that decapitation because it cuts off the nerve flow. And it absolutely is. That's the best way. If the French had it right. Guillotine them and they're dead instantly. Okay? Okay? They're dead instantly. Because if you go through the brainstem in that area and cut things off, your body just stops. Okay? If you don't have the proper communication from brain to body, there's no way the headaches are going to go away. God bless. There's no way your headaches are going to go away in the first place. But before you start saying, oh, let me take this, this, and this, and change all my diet, make sure that you have things going in the right direction, build a foundation, and then add the stuff. You can add this stuff and it might have Gesundheit. It's because I said it, that's right. But it's really, really important. You know, I talked about, you know, earlier, pain. And, you know, we are doing our Children's Health Day. Two things. If anybody wants to help us with our Children's Health Day, please volunteer, and we need people to help us, okay? You know, I usually don't do that in the workshops, but we do need people to help us. It's an event that I do every year for the community. We have a clown, we have a petting zoo, we have live music. It's open to the families and adults. The live music is great. The guy, Randy, is great. He sings like 70s, 80s music. He's great. He is great. Free barbecue. I give out drinks, non-alcoholic drinks. And it's to benefit a young, the reason I'm talking about it is because it's to benefit a young woman who's a chiropractor, who we know very, very well, and didn't have any pain whatsoever. She has 3 children from the age of 2 to 8, or 3 to 8, I forget the youngest one's age. And she had a lump on her chest, and she had stage 4 cancer. Okay? Okay? In her spine, in her liver, okay? And she had no pain. If you see her now, she went to Mexico for treatment. She didn't get the typical classical treatment here. She went alternative. All her tumors shrunk. Okay? And if you see her, she looks phenomenal. She looked great before, but she looks absolutely, she's radiant, she's glowing. And I'm sitting there and I'm thinking to myself, why doesn't that happen here when people get cancer treatment? Okay? But the thing is, she was taking care of herself for a long time before that came up. So her body was better able to adapt, okay, because she was doing something before. She was eating right, she was doing the things. It made a difference when this stuff came. It doesn't mean it's going to keep you from getting them, but it definitely gives you a better chance of healing. Okay, and we are doing a raffle at that to help her with the costs of everything that's going on, because even, you know, the costs become astronomical when you go through something like that. And she's got 3 kids. You guys need to understand, there's more to this. This is about life. This is about community. This is about getting people to understand and be inspired to take part in their own health. Okay? I encourage you, please, ask people to come in to the workshops. Ask people, you know, and don't give up, because, you know, people say, oh, it doesn't work, it doesn't work. Yeah, they've tried it for like 1 or 2 visits, but when does the kid stop asking for the cookie?
Never.
Never, right. Yeah, you know. They never stop asking for the cookie until they get it, okay? I'm not saying be that person that constantly, but just remind people, give them the grain of salt, give them the seed, okay? And just let them understand. They don't have to be patients here, but they can be educated, okay? But if they want to get checked, great. If, you know, we can check them. If they want, you know, if they want to bring more people, great, okay? Because ultimately our goal here is to have a facility that is educating people on how to stay healthy, okay? We build it from a foundation of chiropractic, and we show you why we do that, okay? And I've experienced it personally. But we do it to help individuals like Dr. Erica Calgagno, who's up in Tilton, okay? That's why we do it, okay? It has nothing to do with anything but that. So I thank you for being here. Sorry it ran a little late. Sorry it ran a little late. You guys have a wonderful, wonderful evening. I will get fined for being late. So. I get fined by my staff. They say, you ran late. You gotta, you know. I get it. Are there any questions? If anybody wants to hang out and ask me questions, I'm available. I always forget how to shut this thing off.